We have been focused on understanding more about essential oils than what we've ever understood before, about their safety, about their usage. And so we've chosen to partner with researchers and scientists in the medical community as our source for understanding what essential oils really truly are and how we can best receive benefits from them. This is the perfect way and opportunity for us to be able to understand what we currently don't about essential oils, but more importantly, be able to implement those findings into resources that are valuable for us as the end user.
I'm a physician assistant with Duke University Hospital, and I work in the Department of Surgery with plastic surgery and orthopedic surgery. I wanted to start with a quality improvement project and use the oils on patients after breast reconstruction to help with sleep, pain control, and mood. I see this as a small pilot study that if we get good supporting evidence that it does help, that I hope to put it at a big scale level to have all patients at our hospital use it and have it on our formulary, which would enable nursing or doctors to order it and have patients use it to maybe decrease medications we give that have interactions, that have side effects. I'm going to have the lavender given to the patient before surgery, actually while they're asleep during surgery, after surgery, and then applying it to the skin and let the patient inhale it to help with relaxation. The goal is to, over time, to see decrease in pain scores, to see maybe decrease in the narcotic use or the pain medication, and to hopefully see improvement in their mood, their anxiety, and maybe seeing some improvement in their sleep.
As I looked at the chemistry of the essential oils, it's fascinating for me because at the end of the day, chemistry is chemistry. Whether you're getting it from a laboratory where they create that chemistry or whether you're getting it from a plant, what is important is the physiologic effect on the body. We've been used to being exposed to organic compounds for years and for centuries and centuries. Then it makes it much easier for the body to recognize and utilize those chemical structures as opposed to something that's created in the laboratory. The biggest pushback that I get from colleagues is the fact that we don't have enough information yet on essential oils. I think if they were to truly look, that they would find that there is plenty there, and it's exciting to see that there's more to come.
Natural products is another area that we've kind of shied away from in the scientific field. We've really focused on these synthetic products, things that we can man-make in the laboratory, and they also have their time and place, but we can't discredit things that come from our natural world. Some of the greatest drugs that have ever been developed are things that have come from natural products. So I work with very rare tumors. They're sarcomas, and they typically affect young people, adolescents, people in their early 20s, 30s. Because it's such a rare disease, there's not a lot of research out there being done on that. And clearly there's no essential oil research that's been done with sarcomas. Right now what I've done is looked at several different essential oils and done a lot of assays where we've looked at cells in a dish and saw that there was a nice response to many of these oils at sub-toxic levels.
So for years I've been drawn to essential oils because of their particularly powerful effects it has on patients. As I've attended to the many needs patients have, some of those are to help them be more relaxed in the clinical setting. And so all of my patients for the last many years when they come in have a complimentary hand, forearm, foot, and calf massage with essential oils that have an excellent track record helping people relax, and in some clinical studies demonstrate decreased heart rate, blood pressure, and overall anxiety. We're doing some research right now where we're following patients before they have the therapy and after, and actually testing their blood pressure and assessing their heart rate and assessing their amount of anxiety prior to and after, and have found an excellent response to this particular type of therapeutic modality. When patients are preparing for surgery, we'll have a discussion with them about what to expect, and I introduce them to medicinal grade essential oils that have a really good track record with decreasing perioperative nausea, particularly motion hypersensitivity. And so what we'll do is give them a spritzer of that particular essential oil in their palm, and they're given instructions not to touch their face, just to take deep breaths through their nose and through their mouth to deliver that particular essential oil to the part of their body that needs that. The 4 that I use are peppermint, ginger, spearmint, and cardamom.
It's more than just understanding the science, it's the application of that science and that methodology. doTERRA does that better than anyone. Our commitment is resolute. We will continue to push the envelope and to discover more, because in the end, it's what makes the oils most valuable to each one of us.